So we're back with an interesting case, but an important case for various examination. So let us start. Over the course of 2 weeks, an elderly man develops a low-grade fever and signs of endocarditis. His doctor becomes concerned about colon cancer after receiving a blood culture report. So, what is the most likely diagnosis and what is the most likely agent? Now, it is a very short case, but as you can see that the diagnosis is obvious to many of you, but some of you do not know about this organism. So that's why I have put this case to emphasize the clinical importance about it. Okay. So guess what this organism is? Yes, so diagnosis is very obvious. It is subacute bacterial endocarditis, and the causative agent is the Streptococcus gallolyticus, earlier known as Streptococcus bovis. And the Streptococcus bovis, Streptococcus equinus complex has four major species. So the gallolyticus is in a phenotypic name of biotype 1, Streptococcus bovis biotype 1. And some people also call it as Streptococcus gallolyticus subspecies gallolyticus. Biotype 2 is divided into 2.1 and 2.2. 2.2 has a species known as Streptococcus pasteuриanus, and that is considered as a subspecies of Gallolyticus. But biotype 2.1 has two species, Luteensis and Infantarius. But the most important one is Streptococcus gallolyticus itself. Now, what is the pathogenesis? Now, these four species, they are the important cause of bacteremia as well as infective endocarditis in adults. But there is a strong association between these four species infection and colonic neoplasm as well as other lesions of GI tract, especially for the Streptococcus gallolyticus. So, if you are suspecting Streptococcus bovis bacteremia, it indicates that colonic carcinoma or inflammatory bowel disease or other GI diseases as it invades through GI lesions. So, pathogenesis is that these bacteria, they are normal flora of lower GI tract. They penetrate the epithelium through lesions in colon, either colon cancer or inflammatory bowel disease or other GI diseases, and they enter the lymphatics and then they enter the bloodstream, and then they can involve the aortic valve by adhering to platelet fibrin aggregates and causing the subacute bacterial endocarditis. So the line of investigation is very interesting. So obviously, if it is an endocarditis, we will do echocardiography. So it is expected that if bacteremia is there, you will perform the transthoracic echocardiogram initially, and if results are negative, but still you are clinically suspicious, or there is risk of the complications of infective endocarditis, then you should go for transesophageal echocardiogram. So that is obviously we are going to do. Then blood culture, that is mandatory. You have to do it in infective endocarditis. So three sets of blood culture will be collected, and gram-positive cocaine chain, uh, catalase negative, which grow in 40% bile, but not in 6.5% NaCl. This is the point which it differentiates it from the enterococci. And it also could be alpha, beta, or gamma hemolytic. But you will also order colonoscopy. So it is recommended that adults with bacteremia should undergo colonoscopy to evaluate for carcinoma and other colonic lesion. This is most important for patients with bacteremia due to the gallolyticus, that is S. bovis biotype 1, or also known as Streptococcus gallolyticus subspecies gallolyticus, as well as all those Streptococcus bovis isolate who are not identified up to subspecies level. So it may be gallolyticus. By that point of view, we should do colonoscopy in them as well. So if negative, colonoscopy should be repeated in 4 to 6 months. This bacteremia should also undergo liver function test because these bacteria, they are also associated very strongly with spontaneous bacterial peritonitis. So those who have risk factor associated with either hepatitis B or C should also be screened for this disease. If patient exhibit abnormal LFT or spontaneous peritonitis or indication of cirrhosis, then also you should do the abdominal sonography or ultrasound. Treatment, the recommended is ceftriaxone. Penicillin may be given, but the dosing regime might be difficult, so ceftriaxone is preferred. If person is beta-lactam allergic, then you should go for vancomycin. So that's it. I hope you enjoyed this case. For more such cases, do subscribe to the channel. So when I post a new video about any cases in microbiology, you get immediate notification. If you like it, share it with your friends and colleagues. Happy learning.